So here at ASH 2019, on behalf of my co-authors, I was able to present the characteristics and findings of a specific group of patients with a rare blood cancer. That's known as BPDCN, or blastic plasmacytoid dendritic cell neoplasm. A historically rare but aggressive blood cancer, which overall survival has been reported as 1 to 2 years in most series. Historically, there was no approved therapy, but I was fortunate to be part of the team that led the FDA approval for a novel drug called tagraxofusp, which was approved by the FDA in the United States December 2018, so almost exactly 1 year ago, and we published these results in the New England Journal of Medicine in April of 2019. In this group of patients, what we have observed is we've been following them for almost a decade now, and I showed two major results. One is that it's very common for these patients to have a separate second blood cancer, either prior to or at the time or even after the diagnosis of the BPDCN. And that's important. That may be up to a fifth or more of the patients, 20% or more. The second finding is that despite having a second blood cancer, most of these patients exhibited the ability to still be able to be considered for clinical trials, and I think it's important. So the take-home point is I think there should be a separate category to annotate these patients. I call it PCHM, prior concomitant hematologic malignancies, but that these patients should be included in clinical trials because it's so common to have this, and that they can still have benefit and still be able to be investigated. So common to have a separate second cancer, but it's so common that I think these patients should be included in all of our investigations, and the science should be further explored. So this is a very important area for our patients and researchers out there.